Benefit standards. As employers explore their options to design and provide health benefits for their employees, they will hear various terms regarding the standards for those benefits. This video is intended to offer you a better understanding of three of those standards: minimum essential coverage, essential health benefits, and minimum value. Each of these three terms indicate very specific standards for the quality and applicability of an employer health plan offering, and each will subsequently impact the cost of the benefits as well as the employer's exposure to the employer mandate. Minimum essential coverage, or MEC, is generally the lowest or most basic tier of the three benefit standards that we're exploring. Minimum essential coverage allows individuals to avoid the individual penalty for not having coverage, and additionally allows employers to avoid the employer mandate penalty for not offering employees coverage. Basically, the minimum essential coverage includes all government-based insurance and most job-based and private insurance. Minimum essential coverage is commonly available anytime an individual or employer acquires a major medical plan that follows the majority of rules set forth by the ACA. However, a critical exception is plans that provide only limited benefits, such as coverage only for vision care or dental care, and Medicaid covering only certain benefits such as family planning, workers' compensation, or disability policies. Essential health benefits is the next highest benefit standard in that it specifies the healthcare service categories that must be covered by plans that offer qualified health plans. The Affordable Care Act ensures health plans offered in the individual and small group markets, both inside and outside of the health insurance marketplace, offer a comprehensive package of items and services. Essential health benefits must include items and services within at least the following 10 categories: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and chronic disease management, and pediatric services, including oral and vision care. Minimum value is the highest of the three ACA standards and ensures health insurance policies and plans pay on average at least 60% of the total allowed cost of benefits under the plan. This means that enrollees pay, via deductibles, coinsurance, copayments, and other out-of-pocket amounts, on average no more than 40% of the total allowed cost of benefits. Minimum value does not take into account the amount paid for premiums. An example of an employer plan that might not meet the 60% requirement is a mini-med or catastrophic coverage-only plan. Minimum value affects large employers because the health plans they offer must meet minimum value and affordability in order to avoid possible penalties under the employer shared responsibility provisions of the ACA. Individual and small employer plans, unless grandfathered, must also provide at least minimum value and additionally must meet specified actuarial values. As the ACA evolves, employers are going to increasingly understand the standards that define coverage, as well as their and their employees' exposure to ACA penalties. By understanding these standards and their impacts, employers will be in the best position to make the best choices for their business and their employees.